Welcome to the satellite symposium called HIV, Selfcare, and COVID-19, Lessons for the Future of the HIV Response, an AIDS 2020 satellite hosted by the Selfcare Trailblazer Group, Children's Investment Fund Foundation, PSI, the International Planned Parenthood Federation, PATH, FHI 360, JPIGO, and AIDS Funds. My name is Andrea Gunawan, and I will be your moderator for the 45-minute session, and will be joined by four panelists. The Selfcare Trailblazers Group, SCTG, is a global coalition of partners dedicated to advancing the evidence, practice, learning, and policy landscape of self-care for sexual and reproductive health and rights. The SSTG promotes the adoption and implementation of the World Health Organization Consolidated Guideline on Self-Care Interventions for Health, Sexual and Reproductive Health and Rights, as well as support the wider community in advancing self-care at the global, regional, national, and local levels. Self-care is the ability of individuals, families, and communities to promote health, prevent diseases, maintain health, and cope with illnesses and disability with or without the support of a healthcare provider. While this is a broad definition that includes many activities, it is important for health policy to recognize the importance of self-care, especially where it intersects with health system and health professionals. Within the WHO's Consolidated Guideline on Self-Care Interventions for Health are the new and existing recommendations for self-care, including condoms, self-collection of samples for STI testing, HIV self-testing, and self-efficacy and empowerment for women living with HIV. Now, I'm Andrea. I'm an influencer based in Jakarta, Indonesia, and I've been working closely with linkages for the past 2 years to raise the awareness of HIV testing in Jakarta and in Indonesia. And because we've got a lot of judgment from the healthcare providers, so we encourage our audience to get self-tested at home. And that's why I feel that we need to talk more about self-care. And in light of COVID-19 related effects on facility-based healthcare, for example, like compromised safety and quality of facility-based care, paired with access challenges due to lockdowns, fear, etc., self-care has been rapidly thrust into the spotlight as a means for continuity of health services. Efforts to bring self-care into practice have raised important questions about what clients are capable of doing for themselves, what health system might offer to facilitate such self-care, and how health interventions could be made more client-led or self-managed. How has this played out in the HIV space during COVID-19? What questions do you see being asked around self-care, and what solutions have been deployed to facilitate it? And now we already have our 4 panelists here. Okay.
Hi, good morning.
Hi, good morning, everyone.
Good morning, everyone.
So we have Davina Kanagasebe from PATH, and Davina is a global health practitioner with more than 11 years of experience. She currently serves as a technical advisor for HIV at PATH, primarily supporting efforts to advance differentiated client-centered HIV services, including HIV self-testing and PrEP in Democratic Republic of Congo through the USAID-funded Integrated HIV/AIDS project. And then we also have Kanisa Kwacha from WITS RHI. Kanisha is a young demand creation officer working on Project PrEP in the Swanee area of South Africa. Kani is proud of her PrEP use and happy to share her experiences on her journey to protection. She developed a daily video diary, which is currently flowing through social media channels. And then we also have Anderson Langdon from Barbados Family Planning Association. Anderson Langdon is the youngest appointed executive director of the BFPA, better known as the Barbados Family Planning Association, at the age of 37. Mr. Langdon has served as project coordinator of the USAID-funded Linkages Barbados project collaboration with the Ministry of Health and other civil society partners, which increased the access of HIV/STI testing, treatment, and care to the most vulnerable persons in Barbados, with over 1,000 persons reached in 1 year. And then we have Filippo Zimbila from AIDS Fund. Filippo is the program manager for eHealth at AIDS Fund. He also works as the National eHealth Coordinator at the RIVM, Netherlands Institute for Public Health and the Environment, on sexual health for adolescents and young people. Hi, everyone.
Hi, Andrea.
How's everyone doing?
Good, thanks, and you?
COVID. Yeah.
We're safe at home.
So how long have you guys been home? Been quarantined home? It's been 4 months here for me in Jakarta.
Same for me in DC.
3 months, which ended 2 weeks ago.
3 months in South Africa.
Okay, and what about you, Filippo?
Well, I'm at the office right now, but I've been at home for 2.5 months. Yes.
Okay. Okay. So talking about self-care, what are the clients really capable of doing themselves? What are some things that clients are now doing themselves because of the pandemic? To what degree are they working as intended? Maybe Filippo could tell us more about this.
Thank you. Well, I think that in general, if clients have certain basic skills, they are capable of doing a lot themselves. And I think also important is that I feel that they are also willing to do a lot themselves, especially if we're talking about sexual health. Because, well, we like privacy around that subject. There is stigma, there's taboo. So then if you can do it yourself, that can be very pleasant. And of course, self-care tools are combined with some general advantages like no travel time needed, no waiting queues. Mostly they are available 24 hours a day, 7 days a week. So that are strong benefits for clients. But I still think that at this moment, learning more about how the end users see a good self-care infrastructure, what is nice for them, I think that we can do more research and find out together with them how we can build that infrastructure. Well, if I then look at the Dutch situation, I think in theory, clients can do a lot about screening for STIs themselves. I mean, the tools, the technologies, they exist and they give them the possibility to do self-assessment of risks, and then they can select the right tests. They know where to test, and they can order them online. So I think that infrastructure is possible. But in practice, I think, and you see that as well in the Netherlands, you see that not everybody is capable. There are some vulnerable client groups, maybe because of low social economic status, maybe because of their background, sex workers, drug users, and they need support from professionals. The support of professionals, I think that in many countries that is the same, is scarce. And that's why we in the Netherlands started to develop the step care model. I would really like to show you a sheet to show them how it looks, but unfortunately that is not possible. But the basic steps are, general information about comprehensive sexual health. On the next step of the step care model, you have those self-assessment tools where you can see your own risks, and they can help to support your self-management. And the key elements of this self-care model is to encourage self-care as much as possible among clients who can, so that you can use the capacity of the health professionals to support those who really need it, the more vulnerable clients. And another important objective of the step care model is to link the right level of professional support, that it is just sufficient. So maybe you need, like on step 3 of the step care model, you have information professional. Maybe that's sufficient to help you further. Or you need a nurse with more medical advice. And the most scarce professional, usually the doctors, only for those who really need it. So during the lockdown, we met here in the Netherlands, we've seen that a lot of our clinics and municipal health centers strongly limited their services. Some even closed them. And what you saw is that they redirected their clients to step 2. So the self-assessment tool to have them estimate whether or not STI testing is really important. And if so, they are referred to, for instance, commercial partners. So you order them online, and of course, because everybody is working in the step care model as organized here in the Netherlands, we have some quality checks so that we make sure that they're not linked to commercial partners who have unreliable testing material. So I think that's, we saw that really the commercial partners of us, there was an increase in the number of online ordered testing samples.
Okay, thank you so much, Filippo. So I think it's important for to educate the users as well, and then to increase awareness, so it can increase the demand for online assessment and testing as well.
Yes, okay. It can be a good alternative. Yes.
Yeah. And then, okay, how has COVID-19 impacted HIV prevention and treatment services provision, including for existing self-care approaches or adaptations to integrate self-care in standard approaches? I think Anderson is an expert in this.
Expert, I don't know. Hi, Andrea. Just let me say to everyone there, what has really happened is that COVID has given a jolt to the reality of things we were lagging in healthcare in general. I think especially when it comes to working with the client, we've discussed many technologies that have been available before COVID, but we haven't utilized them as well as we should. And I think what has happened is that COVID-19 has fast forwarded how we maybe think about delivering healthcare and how we treat our staff and the way we deliver healthcare. And in doing that, we've been, I don't want to use the exact word, we've given a kick in the, and we've moved forward because we have to. Certainly, and that's impacted existing approaches. With regards to integration or adaptation of self-care standard approaches, what has happened is that you have to first look at the capacity and the ability of your staff to deliver self-care or empower clients to engage in self-care approaches. And that is what the first thing we have to begin with, making sure that our professionals are on board and equipped to guide possible clients in the development of self-care approaches. Certainly for us, and I was very happy with the definition that was given, that we take the time to work from the bottom. We talk about individual, but we will have to work with community groups. At this point, we have to start with the community. What we did in Barbados when we had when we started with linkages And then with the continuation support of the International Planned Parenthood Federation, we look to build the community interventions body, because the communities, the most at-risk groups, they're the ones who work daily with the individuals, not just in HIV healthcare delivery, the LGBT community. They're constantly active working. So we built the network, which strengthened our relationship with these groups. And what we did on the back end is that we then catered the service delivery for the needs of the community based on the recommendations of the community interventions. What ended up happening, we ended up changing our model, and we were prepared to, but like I said, COVID made the change even more apparent. We had to switch to more online models. We had to make sure that our clients and our staff in healthcare delivery had the tools. We're struggling with that. For example, now in my collaboration with UNFPA, we're seeing the demand during COVID, especially on the e-platforms. That's why we also looking to transition to telemedicine. I mean, I know we can tend to use Instagram, Facebook, TikTok for personal use, but these are where people are at already. What I can say in Barbados, we're lucky that a lot of people have access to data, because we're 99% of the population has access to the internet via mobile or otherwise. Yeah. So we're lucky to have that. Not saying that we reach everybody, but so we're able to see the response even via queries. And then we transition to a telehealth model, which is supported by PPF and other agencies, in which we can, and Filippo was saying something very interesting. It cannot just be in the beginning of that intervention, doctor-centered. It has to be different aspects of healthcare delivery. Certainly psychosocial support and self-awareness is something that we have to work on in delivering healthcare. So the adaptations that we're making to the self-care model has to begin, yes, with the healthcare professional, within the community, and empowering the individual. I don't want to spend too long because we have much more things to do, and it's going to come up, I'm sure, from the others in their discussion as well.
Mm-hmm. What do you think, Davina?
Thank you, Andrea.
What about in India?
So I think generally, as you've said, COVID-19, the impact, one of the key impacts is sort of the creation of additional obstacles for individuals and particularly vulnerable populations to access HIV testing, treatment, prevention and support services, and that's due to the impact of lockdown orders, transportation restrictions, as well as diversions in health facility resources towards COVID-19. And then in looking at our programming across DRC and Vietnam, Kenya, and a major trend that we were noticing at the beginning of the pandemic was this observed sort of decrease in the number of individuals accessing HIV and other health services, and particularly seeing reduced foot traffic in facilities, and even in some contexts on community service delivery points. And so accompanying this decreased foot traffic were reductions in the number of individuals seeking and accessing testing and prevention services. And so to ensure the continuity of HIV services, we rapidly increased differentiated HIV testing, treatment, and prevention service delivery models. So really increasing decentralized, out-of-facility-based distribution and expanding client-directed services. So effectively providing multiple options for how and where people could access and receive services. In particular, focusing on use of digital platforms, as Anderson mentioned, private sector distribution channels, especially pharmacies, and decentralized delivery either at home or community outlets. So just to provide a few examples, first, so in the DRC, we really accelerated the introduction of self-testing during COVID-19 by offering it at pharmacies for individuals who are going there instead of facilities to seek services. So with the pharmacist conducting a self-risk assessment, and then offering assisted self-testing to at-risk individuals who are then provided with an accompanied referral to a facility by a community health worker for a confirmatory diagnosis.
Is it for free?
Yes, the client did not have to pay for that service. Yeah. And then linkage to either treatment or PrEP services. A similar model we used in Ukraine to maintain safe testing services for partners of HIV positive people who inject drugs. So offering the index clients an option of receiving at-home assisted or unassisted self-testing services for their partners, or delivery of a self-test kit at a public location. And in both Kenya and Vietnam, we really amplified use of virtual and digital platforms to promote, counsel, and reach MSM, transgender women, and adolescent girls and young women with self-testing and PrEP services. So for example, in Kenya, we sort of created more than 100 virtual safe spaces for adolescent girls and young women where they were able to access information and group-based counseling on PrEP and testing services via WhatsApp. And then for those interested in either self-testing or PrEP, able to follow up individually over the phone for a guided self-risk assessment and to schedule an appointment for PrEP initiation or home delivery of a self-test kit. And then finally in Vietnam, during COVID-19, we sort of really amplified our hashtag Prep for Love and hashtag Stay Homes, hashtag self-test campaigns, generating demand for both PrEP and testing through a number of online channels, so Facebook, TikTok, dating apps like Grindr and Blued, and through online peer influencers and chatbots, all of which link to an online ordering platform for either self-testing or PrEP, where clients could go through an online risk assessment, received individualized counseling from a peer provider virtually, and then provided with options for how they want self-testing, PrEP, or home-based labs delivered, like either through mail, courier service, or pickup at a key population-led organization. So, sorry, I'll stop there.
Wow. Yeah, we really need to adjust everything. Yeah, and really make use of the technology during COVID, especially to reach the target audience as well. Thank you for sharing. And speaking of, what are the opportunities and challenges for generating demand for self-care interventions? What about, Kanyi, maybe you can share from your experience.
First of all, I believe we need more people like myself, people from the community who understand what self-care is and why it is important, not just for an individual, but for the whole community. It is a broad concept, and we need to break it down for young people like myself and other community agents, because if we really understand what it is and why is it important, we can advocate for it more in our communities. I believe if people in our communities are educated about self-care, they will be open to it and we can start a whole new conversation. For instance, imagine we can educate mothers and daughters together about the importance of self-examining their breasts for possible signs of cancer and be aware of the warning signs. We could prevent so many women from falling ill and getting the help that they seek in a very early stage of the cancer if they do have it. If we start with this kind of self-awareness, the information and education, the self-efficacy, I believe it will pave the way for more interventions. And finally, also to have a generation of people who feel comfortable with the concept of self-management. Like feeling empowered enough to take your PrEP tablets every day for 2 months without needing the intervention of a healthcare provider. But first, we must start with making self-care famous, because a lot of people are not aware of what is self-care. Making sure that everybody knows exactly what it means and how it will benefit not just an individual, but then the whole community. Yes, thank you.
Yes, thank you, Kanyi. Yeah, I agree with you, because we need to start talking more about it so that people are inspired to take actions as well. So, wow, thank you. Yeah, especially in Indonesia, I can relate so much because it's a taboo, topic to talk about. Yeah, and then, okay, based on your experience, where have self-care interventions like HIV self-testing made the biggest impact? And then which groups can particularly benefit from these types of interventions? Maybe Filippo can share.
Thank you, Andrea. I think I go further where Kanya ended, because I think the impact occurs on different levels. I think it's already been shown that the accessibility and the acceptability and the reach among certain groups, for example, people who have not have attached yet, or people who have greater distance to healthcare services, now can be reached and can be supported. For them, it's very attractive to do the self-testing and the self-assessment in their own private, safe environment. And then I think the impact is also on the healthcare system itself, the professionals, the services, because it really can reduce the pressure on them. I mean, the waiting queues, and it makes it possible for them to focus on those who really need it. And I think that you also see that more self-aware, more self-assessment, they come better prepared to the clinics. So you can work more efficient. And it's not only better prepared, I guess. I think a beautiful example I saw in South Africa in our discussion when we were developing the stepped care model for South Africa, discussing contraceptives. Sometimes you are confronted with a clinic who has just this one method for contraception. Through self-awareness and general information on websites, by doing a self-assessment tool, girls can learn that there are alternative contraception methods who are better suitable for their personal situation. And such a self-assessment tool can also refer you to the addresses from clinics who can provide the special that kind of method which is more suitable, appropriate for your situation. So I think on those levels, I think this can have a lot of impact, and an important impact. And I totally agree with Kanya that investing in school-based comprehensive sexuality education is then you're preparing the next generation to be more self-caring and learn how it works and be more effective within all the services that are provided. So that's, I think, very important.
Thank you, Filippo. Do you have any additional information, Davina?
No, I think Filippo sort of echoed what a lot of what I was thinking. I think for me, like the biggest advantage and impact of self-care health interventions like self-testing or delivering PrEP or ART services in ways that offer options and are responsive to client choice is really this ability to improve outreach and access to those who are currently not being reached, especially through facility-based services. So including people who might be more active online and particularly men, young people, and key populations. I think Filippo mentioned there's a lot of data on how self-care and like self-testing is helpful in reaching first-time or infrequent testers. We saw this in Vietnam recently with our hashtag Stay Home Self-Test campaign. Of the majority of individuals who were accessing self-testing services online, by 85% were young MSM, and they really said that it was the online content that drove them to seek testing services. And of those who self-tested during this campaign, 28% were first-time testers. And this is not really a new observation. In our programming in Vietnam, like 67% of clients that we reach through lay provider testing were also first-time testers. And also looking at PrEP delivery in both Vietnam with key populations, as well as in Kenya with adolescent girls and young women, we're really seeing and hearing the strong preference to receive PrEP services from peers and trusted mentors. And the data just is showing much higher PrEP enrollment and continuation rates when PrEP is made available through online channels or delivered by peers and other trusted lay providers. So yeah, I think self-testing and delivering differentiated HIV services outside of facilities just increases convenience and privacy and enables people to access HIV testing or prevention services in a setting or from a provider that they are much more comfortable with and where they feel that they won't be judged. And this is so critical in improving access to and uptake of HIV and other health services, especially among groups who are otherwise untouched or unreached.
Thank you, Davina. And Anderson, do you have any ideas on how can we make self-care approaches more accessible to a broader range of individuals? I mean, well, we've talked about online campaigns, but maybe can it be more accessible to like individuals who don't use online social media, for example?
Sure. Well, I was listening to the others, and one thing that stood out for me is that I've seen the demand being asked for by those at-risk groups here. They're asking for it. They're already seeing the information. They're already hearing the information. And I think one of the things that we as healthcare providers need to do is listen to what the clients want instead of just delivering healthcare. I think the impact is on changing national programming that is responsive directly to the individual and the community needs in terms of the expansion. So there's always contention at the national programming level and at the community level with regards to managing those technical aspects, whether it be quality, whether it be knowledge and information. But what we've seen, interventions where individuals have the most control of to dictate the pace and where they do it, they're more responsive to. When an individual feels that someone is pressuring them into a delivery. And what we've realized, I'm gonna single out to a lesser extent key populations, but men who have sex with men, I think they're also one of the more informed groups as it relates to this. But female sex workers, who they're the ones who, with limited knowledge of self-care management nationally, they're the ones who are saying, if we could do this regularly ourselves, if we could begin that initial testing ourselves and the maintenance of the interventions, because sex workers have high compliance with regards to condom use. So they're the group that if the intervention is working, they're going to stick to it. They're very compliant. And I think that is what needs to happen. I think that is what is going to push the development of self-care management of HIV, as well as general care, especially under COVID. Something as simple as collecting condoms, the way they demand it from themselves, they're the ones who are driving the results. And I think if we allow those communities to drive the results at the community, the individual, we're going to see the impact at the national level, and we're going to save money. We're going to have to focus primarily on things like procurement. We're going to have to drive, and eventually will drive down costs. Inevitably, they're also going to procure themselves, which also positively impacts national supply chains. We have a simple centralization. So there's so many reverberating effects of self-care management, especially when the community or the individual can afford the cost. And in addition, it might even be cheaper at that level. So certainly, there's so much to go and not just at high-risk groups for HIV, youth, we ourselves, that's a cross-cutting group. But they themselves will be able to access their self-care needs, and comprehensive sexuality education, allowing them to be fully informed at earlier levels, as Kanisa said, is going to allow them to, from an early age, access these self-care management tools, as well as testing, screening, and all of that will psychologically impact the individual's ability or want to have treatment and care and make them more adherent. All of these. So if we start right, we will end right.
Yeah, okay, that's a good one. Okay, thank you so much, Anderson. Oh, we have one question from an attendee. So most of your HIV-related examples focus on HIV testing and PrEP. How could you extend the self-care approaches to HIV care, treatment, and support services for people with HIV? I think maybe Filippo or Davina wants to share with us. maybe Filippo?
Please, Divina, because I'm not really an HIV expert. I'm sorry.
Okay.
I'll take a stab at that. Yeah, I know we've focused a lot on self-testing and PrEP, but I think the idea of really differentiating services and putting sort of clients and people at the center of how services are delivered can be applied across the cascade, and similarly to treatment. So again, we didn't really touch on this a lot, but a lot of the recommendations for adapting HIV programming for COVID-19 is really, again, decentralizing services out of the facility. So offering ART support services through community-based support groups, distributing treatment there, using pharmacies as dispensing points, and also doing home deliveries of ARVs, and all of which we have been doing with success in Ukraine, Kenya, and DRC, and there is a lot of demand for that. In terms of support services, I touched on sort of some of the virtual self-help groups that we've set up for adolescent girls and young women in Kenya for HIV prevention, and we've done the same thing with self-help groups during COVID-19, taking them virtual, using WhatsApp as a way to connect people virtually during stay-at-home orders. And, you know, to the extent with obviously supporting physical distancing and safe masking practices, being able to also have some limited community-based support groups as well. But yeah, I think differentiating services is key to really driving us towards the ending the HIV epidemic. So it's a great question, and yeah.
Thank you. And we have 1 more minute for another last question from an attendee. How is the prevalence of IPV affecting self-care?
So we were concerned during the lockdown with regards to the spread of intimate partner violence. Past research has shown, and I'm glad the person used the term intimate partner violence because it not only focuses on gender-based violence, but occurs across both men and female during this period. And we are a bit concerned, I think, internationally with regards to how relationships are managed, because I'm going to speak frankly, in my real Beijing, Barbadian context. There are people who are involved that don't like to be in each other's company all the time. They're partners.
Yeah.
No, they're people who live together that engage in, they're people who are at risk for gender-based violence with the particular partner. It's sexual-based violence, and there's a correlation between sexual-based violence, gender-based violence, and the increase of HIV and STIs. And it is a greatest concern. As for me nationally, we haven't seen that as yet in terms of correlation to HIV. But my concern is that this is what is expected. This is what I expect. People who are who have physical, financial power during periods like these take advantage of individuals. We are extremely concerned, especially with regards to sexual-based violence, that this will increase. But at this point, I'm not seeing any data from my end that says such. I don't know if Davina would have seen any from her end as at this point.
Okay. And we have another question. I feel like most of the HIV people I know gather the best information about self-care has been through support group peer education. I've lived well with HIV for 33 years and have been able to help others be better self-advocates. Do you all know how we can reach people out of care? Maybe Kanyi can help answer this question since you're doing the online campaign as well.
Okay, so most of the time the online campaigns works very best. But then what else that works best is that with the help of the mobile vans that we have, it's very easy to reach those patients that can't come to the clinic. So in South Africa, what we do is that we'll ask around the community where usually people hang around. So that will give us a direction of, okay, this is where the people hang around. So it will be easy for us to go to them rather than for them to come to the facility. So by doing that, it makes them save money and also save time to come to wait to the clinics for the long queue. So they feel that they are important. When someone feels that they are important, it's very easy for them to take their medication and also to continue living a healthy lifestyle.
Okay, yeah, makes sense. And then, okay, one more question. We only have 2 more minutes, actually 1 more minute. From the lessons that you have learned about self-care, do you think self-care is the next big solution in our HIV response? Anyone want to answer this maybe?
I can take a stab at it. Yeah, so I see self-care and like particularly the focus on really driving forward client-centered services as one of the critical tools in the box to sort of getting us to a durable end to the HIV epidemic. Successful HIV prevention and treatment services are really driven by the ability of individuals to seek and then use and keep in those services. So either of their lifetime at this point for the people on treatment or during periods of risk for those accessing PrEP. And differentiated services is a key driver for helping individuals access and use services. And also pushing self-care forward as part of the HIV response will also contribute to sort of concurrent goals of building a stronger primary healthcare system and pushing us forward towards universal health coverage. So.
Well, thank you so much for sharing. And since we're at the end of our session, if you have any more additional questions, feel free to please contact these information on the slide. And thank you everyone for participating in this session. I hope this has been beneficial to everyone. Bye-bye.
Thank you.
Okay. Thank you, everyone. Have a good day.
Thank you.
Okay.